Versed, aka midazolam, can cause amnesia. This is why I do not give it to awake patients during a C-section without their consent, ever. And I always explain that it can impact memory during that consent process. However, there is some data that we may be overestimating that impact. And this does not mean that I think it is ever okay to give sedating medications to women for no reason, especially without consent and explaining all of this. I know what happens. It's not okay. Midazolam is our benzo of choice in anesthesia because it has a rapid onset and a short duration of action. There are 2 small, double-blinded, randomized controlled trials about the use of midazolam during C-sections, which are cited frequently. One included 50 patients total, 25 in midazolam group, 25 in the control group, and they found that with a midazolam dose of 0.125 milligrams per kilogram, there was no difference in recall of delivery between the 2 groups. So for someone who's around 170 to 190 pounds, that's about 1 milligram of midazolam. Another one included 60 patients. 30 patients got both midazolam and fentanyl, and the other 30 was the control group. And they found that with a midazolam dose of 0.02 milligrams per kilogram and a fentanyl dose of 1 microgram per kilogram, there was no difference in delivery recall compared to those patients who didn't get anything. So for someone who's around 170 pounds, that's about 1.5 milligrams of midazolam and 75 micrograms of fentanyl. In both studies, there was also no difference in outcomes for the babies. I think it really depends on the person, the situation, and the dose.